My name is Dr. Kimberly Davis, Senior Research Scientist and the Director of Community Outreach for the Center for Cancer Research and Therapeutic Development at Clark Atlanta University. I welcome you to this edition of Life Notes. Our focus for today's show is male breast cancer. Though cancer is most commonly thought of, I messed up, though breast cancer, I said though cancer.
You back? And 5, 4, 3, 2, 1.
Hello, my name is Dr. Kimberly Davis, Senior Research Scientist and the Director of Community Outreach for the Center for Cancer Research and Therapeutic Development at Clark Atlanta University. I welcome you to this edition of Life Notes. Our focus for today's show is male breast cancer. Though breast cancer is most commonly thought of as a woman's disease, breast cancer in men does occur. Like breast cancer in women, cancer of the male breast is the uncontrolled growth of the abnormal cells of the breast tissue. At puberty, male hormones, such as testosterone, secreted by the testes, suppress the growth of breast tissue and the development of lobules, or milk-producing glands, found in female breasts. Unlike the female breast, however, the male breast is made up of predominantly undeveloped ducts and a small amount of fat and connective tissue. Like all of the cells of the body, a man's breast duct cells can undergo cancerous changes. But breast cancer is less common in men because they normally have lower levels of female hormones that affect the growth of breast cells, and their breast duct cells are less developed. Our host Paulette is on location to talk with our expert about the different types of male breast cancer, signs you should look for, treatment options, and much more. Now here's the host of Life Notes.
Thank you, Dr. Davis. Male breast cancer is a rare condition accounting for only about 1% of breast cancers across the country. The American Cancer Society estimates that in 2010, about 1,900 new cases of breast cancer in men would be diagnosed, and the disease would cause approximately 390 deaths. Let's hear from our expert and find out what men and those who love them should look for and who's at risk. Hello and welcome to Life Notes. I'm your host, Paulette Payne. Today we're talking with Dr. Tanya Cole at the DeKalb Medical Center and the Department of Oncology and Radiation. We're talking about male breast cancer. Dr. Cole, can you talk to us a little bit about male breast cancer and how it's diagnosed in men?
Well, male breast cancer, when you compare it to female breast cancer, it's actually very, very rare. There are approximately 250,000 cases of breast cancer diagnosed in the U.S. every year, and only about 1% of those occur in men. So you have roughly about 2,500 cases of male breast cancer diagnosed every year. And that only represents about 0.1% of all cancers that are diagnosed in men. So you see that's a very, very rare cancer in a man to occur. But a very timely subject for October, Breast Cancer Awareness Month. Male breast cancer is really diagnosed the same as female breast cancer. It most commonly presents with a painless lump in the breast. For men, though, it's often ignored for quite some time before it's brought to the attention of any primary care physician. And even sometimes when they're brought to the care of the physicians, there's often a lag in diagnosis because male breast cancer is really not something that's on the forefront of a lot of people's mind. So sometimes you can have a lag of up to 10 months before you get a diagnosis of a male breast cancer. But once the suspicion is there, you do a clinical breast exam, you get the patient in for imaging, which is usually a mammogram and an ultrasound, and then they get a biopsy to make the final diagnosis.
Now, how frequent or infrequent should men have mammograms? Is it necessary as a traditional or standard form of screening for men?
Since male breast cancer is so rare, there's really no formal recommendation for routine screening for male breast cancer. Now, there are some groups of men that are at high risk for breast cancer, and those high-risk categories include men that have a strong family history, men that have a documented BRCA2 mutation, if they have increased exposure to estrogen by, say, having a Klinefelter syndrome, which is a man with an extra X chromosome. They have their bodies make more estrogen, or if they've had their testicles removed, or if they've had estrogens given to them as a result of cancer treatment, or transsexuals who are undergoing hormone replacement for gender transition. All of those things put you at increased risk for male breast cancer. Also, being obese, the more fat you have in the body, you actually produce more estrogen. So men who are overweight actually produce more estrogen and are at increased risk as well.
So one of the preventive measures based on this information as it relates to weight is exercise, diet, and monitoring your caloric intake.
Yes, definitely lifestyle changes for actually almost any cancer is the best way to decrease your risk, is to maintain a healthy weight, eat healthy, incorporate fruits and vegetables in your diet. Those are the best ways to try to decrease your risk for breast cancer. Because age, and I didn't say this earlier, but the older you get, it increases your risk for breast cancer as well. And for men, the peak incidence occurs around age 70, 71.
Well, that's good information. So we know the preventive measures, but in those cases where men receive a positive or not so positive diagnosis, what then are the steps for treatment?
Treatment pretty much is the same as for female breast cancer. Since men don't have a lot of breast tissue, most men get a simple mastectomy where all of the breast tissue is removed. And then based on the stage of the cancer, they may or may not benefit from radiation therapy to the chest wall and the lymph node areas. And then most often these cancers tend to be hormone receptor positive for estrogen and progesterone, so they're put on tamoxifen. So typically these cancers are treated very similar to female breast cancer.
Okay, and then what is the survival rate? They're on this treatment for the disease. What then is the survival rate?
The survival rate stage for stage when compared to female breast cancer is about the same. With your stage 1 patients surviving at 5 years about 95%, your stage 2 patients about 85% at 5 years. Stage 3 patients, your survival drops down to about 50%. And when you get to stage 4, which means that your disease has spread beyond the breast to other parts of the body, your survival drops down to about 20 to 25% at 5 years.
Oh, okay. So based on the stage of the disease when it's caught, that determines how positively the treatment will impact the patient.
And unfortunately for male breast cancer, because there is no routine screening out there, about 40% of male breast cancers are actually diagnosed when they're stage 3 or 4. So as a group as a whole, those patients tend to do worse when you compare them to female breast cancer.
Now, let's talk about this disease as it impacts the African American community. We know that it's very rare among men in general, but more specifically, how, in your experience, has this disease impacted the African American community?
When you look at the total number of cases of male breast cancer, when you compare them to females, you get about 100 cases of female breast cancer for every 1 case of male breast cancer in a Caucasian male. In an African American male, you have about 70 cases of female breast cancer for every 1 case of male breast cancer. So you have a slightly increased risk of developing breast cancer in a man if you're African American.
And could we say that environment contributes to this? Is it genetic? Are they genetically
I think part of it is probably genetics. Part of it too, when you look at the histopathology of the tumor itself, African Americans in general tend to have more aggressive tumors than those found in Caucasian men. And I think that histopathology gives you a different, they don't respond as well, which is why they do worse. They tend to be estrogen receptor negative. They don't tend to respond to hormones well, and they act more aggressively. And then I think in our community in particular, our men aren't as apt to go to the doctor as quickly as a Caucasian male. So they're diagnosed much later.
So the takeaway from this conversation is to get tested. Do your annual self-exams or your monthly self-exams. And if there's a lump that's found, see your physician immediately.
I wouldn't say do your monthly self-exams because that's not really recommended for men unless you're high risk. But if you find a lump in the male breast, you definitely want to seek attention. You know, see your primary care physician or your urologist and have that checked out to find out what it is.
And one more thing that I'd like to discuss. We know that no man is an island in any stage in life, but more particularly as it relates to cancer. So how important is it for men to have a unit of support to see them through this process?
Oh, it's very important. I mean, I always say for any cancer patient, you should have someone with you when you come to the doctor, especially in the early stages where you're just finding out information about what you have, when you're having that conversation about the steps for treatment and for diagnosis, because you need a second ear, because a lot of people stop hearing you after they hear the word cancer. So you need someone who's able to go back home later and reiterate to you what was said in the doctor's visit. Because you do have so many patients that will cut their family off. They don't want anybody to know what's going on. And they don't have that support. And a lot of times, because of that, they don't follow through with the treatment the way it's supposed to be done.
Mm-hmm.
And when you do that, you don't get the optimal outcome from the treatment.
So definitely include and not exclude those closest to you.
Definitely. And then, especially with breast cancer, and a male breast cancer in particular, because when we diagnose a male breast cancer, that automatically triggers in our minds as physicians that there could be some genetic predisposition, because up to 40% of male breast cancers have some type of genetic link. So that man should be tested for some type of genetic disorder. And if they're found to be positive, then the females in their life should also be tested as well, because these things are carried down. So if they have any children, if they have any sisters or brothers even, they need to be tested as well, because that will change the screening recommendations for them if they are found to be mutation carriers.
Dr. Cole, thank you so much for sharing this much needed information about male breast cancer. And it's our hope that the men watching today will be mindful of their breasts and should they find a lump, to seek out medical attention. Thank you so much.
You're welcome. Thanks for having me.
Hi, I'm Mekhi Brooks. I play wide receiver Terrence King on USA Network's Necessary Roughness. Let's talk about a game that you don't want to play. African American men have the highest incidence rate of prostate cancer, 65% higher than white men. Even worse, we have the lowest survival rate. In fact, we are 2 to 3 times more likely to die of the disease than most Americans. It's time to go on the defensive. See your doctor. Schedule your PSA screening and your prostate exam. It could save your life, save my dad's. And that's exactly what the researchers at Clark Atlanta University's Center for Cancer Research and Therapeutic Development are working to do daily. Now it's time for you to join the team. Get it done.
There's a monster in my bathtub. There's one on the couch. There's a monster on my bed.
Keep innocent things from triggering an asthma attack.
Please make the monsters go away.
Learn how to stop their asthma attacks at noattacks.org.
Welcome back to Life Notes. In this edition of Caregivers Corner, we will talk with breast cancer survivor Eric Weir about his cancer journey, life after the disease, and his advice to men.
One more time. 5, 4, 3.
Welcome back to Life Notes. In this edition of Caregivers Corner, we'll talk with breast cancer survivor Eric Weir about his cancer journey, life after the disease, and his advice to men. I'm joined today by Mr. Eric Weir, a breast cancer survivor, and he's here to talk to us about his journey. Mr. Weir, thank you so much for taking time out to talk with us today.
Well, you're welcome.
So tell me, when was your breast cancer discovered?
I was diagnosed in June of 2010. I kind of noticed it about 6 months before that, but we didn't know that's what it was. Thought it was something else benign, and they continued to be noticeable and more noticeable, and my doctor at that point recommended that we check it out, and it turned out to be cancer.
And so when you got the news, were you extremely alarmed, or were you just committed to taking the process one step at a time and seeing what happened?
I wasn't alarmed. I mean, by the time I knew definitely that it was cancer, I wasn't alarmed, and I might have, you know, I was going to say it wasn't alarmed. I was just kind of angry, but I wasn't. I wasn't angry. No point in being angry if you don't know what it is. And when I knew what it was, I'd been through the process enough that it was like, okay, well, next step. Well, after diagnosis, then there was a medical team that looked at my case, and they recommended mastectomy, and I met with a surgeon, and even though that was their recommendation, they encouraged me to check out the other options, which in my case, chemo was not in the picture, but I did check out radiation. And there was I was diagnosed in June. I didn't have the surgery until September. I think it was around September 1st. So in between those two times, there was a period of kind of slow getting educated. Part of that was meeting with the doctors and so forth, and talking about the options and reading.
Mm-hmm. And in your study and your research, you learned more about this disease. Did you ever come across any cases where more men than you thought had been diagnosed?
No, I didn't really I never encountered any, there was acknowledgement that it happens to men, but you know, in the literature that they was given, men were not mentioned.
Well, because breast cancer is typically diagnosed among women, was there any embarrassment, any shame of any sort, telling your family or your friends, your loved ones?
No, there wasn't. I didn't want to make a big deal of it, but I didn't want to keep it secret either. So some of my friends knew. I let them know, and my family knew. I have, at that time, I only knew about 4. Now I've got 5 sisters. We discovered that year. Wow. that we had one over in England we didn't know about. But so I've got 5 sisters, and there was a possibility that this was genetic and that they could be at risk. Turns out that was one of the things that was checked out after the surgery, they're not at risk.
Oh, and I'm sure what a relief that was, that news. Mm-hmm. So you're cancer-free. How long have you been cancer-free?
I guess since that surgery is September of 2010.
2010, so 3 years, almost 3 years.
Almost.
What type of treatment are you experiencing now? Are you on any type of medication? Do you have to go to your doctor periodically?
I see my oncologist every 6 months, and they just check me out, make sure there's not anything new showing up, and ask how I'm doing. And we usually talk a fair bit. I mentioned before we started that I had some experience with breast reconstruction that didn't work out very well, and so we often talked about that. But so the regular 6-month check-in with her, and I'm on tamoxifen. My cancer was what's called estrogen progesterone reactive, which means that it can be treated by this medication tamoxifen, which, as I understand it, mimics those hormones, but does so in a way that I mean, the hormones, the cancer that I had was reactive to the hormones. And the hormones, the presence of the hormones in the body, if you have that cancer, the cancer is going to continue, and it's going to be, it could be conceivably be an issue. But if it's estrogen progesterone reactive, and then you can take this medication, and that short circuits that.
And you haven't had any complications at all?
No, they wondered if I would. No hot flashes, no menopause type stuff. No, I haven't had any side effects.
Wow, you're truly a success story.
It was a very, very memorable experience. It was a good experience. It was an experience of just walking through the moments and having this whole universe of people around you taking care of you. Was
it easy to receive that?
Yeah. When they right before the definite diagnosis, they did a I forget what it's called. It's a sonic imaging, where they rub a wand over the surface of your body that they're checking out. And at that time, there were several people in the room. The technician who does that, two of the technicians who do that kind of work, a doctor, and then there was the director of the breast imaging center at Emory. It was a male, a doctor. I don't remember his name. I think that at that point they knew, once they saw certain things in that image, they knew that I had cancer, but they were going to do a biopsy. And they didn't tell me that I had cancer. But this doctor, the director of the breast imaging, as they were winding down, he gave me his card and he said, "Stay in touch. I want to know how this goes."
Oh.
And that was an example of the way it went.
Well, it sounds like this circle of compassionate care has been critical in your healing, your recovery, and your survival. And we're just very happy that you took time to talk with us, because I'm sure there's some men out there watching that could potentially be, breast cancer patients and subsequent survivors. So this information was very important to share. Thank you so much, Mr.
You're
Weir.
welcome.
Mr. Weir contributes his successful treatment and recovery to living a healthy lifestyle before his diagnosis. He says a life filled with swimming, running, and healthy eating made the road to survivorship a much easier one to travel. Many thanks to Mr. Weir for joining us and sharing his story. Again, men, while it may be an uncomfortable subject to talk about, be sure to tell your doctor about any abnormal changes in your breast. Skin dimpling, nipple retraction, redness or scaling of the nipple or breast skin, and nipple discharge should be reported to your doctor immediately.
What if a disaster strikes without warning? What if life as you know it has completely turned on its head? What if everything familiar becomes anything but? Before a disaster turns your family's world upside down, it's up to you to be ready. Get a kit, make a plan, be informed today. Learn how at ready.gov.
On behalf of the CCRTD, I hope you enjoyed this edition of Life Notes. We would like to thank our guest expert, Ann Eric Ware, for sharing their expertise and experiences with us. If you or someone you know has been diagnosed with male breast cancer, the CCRTD is available to assist you in navigating your healthcare needs and choices. The CCRTD has access to a network of organizations and facilities that enable us to keep you informed of the latest advances, treatments, and information in the medical community. We can help you find answers to any question you may have regarding your condition or healthcare needs. To learn more about the CCRTD and the services we offer, please contact us at 404-880-6878 or via email at www.ccrtd.cau.edu. Thank you for watching Life Notes. We hope this edition of Life Notes has in some way encouraged you to take note of life in a meaningful and helpful way. The Center for Cancer Research and Therapeutic Development is committed to bringing you information about cancers that disproportionately affect the African American community.